Okay, Stephen Ratner wrote a New York Times op-ed piece, I think it was a week ago last Saturday, and I read it and I couldn't believe it got no coverage anywhere. Here's a guy from the Obama administration saying we need death panels, using those words. Those are the first words in the op-ed piece. Who's Stephen Ratner?
Well, Stephen Ratner has no functional medical knowledge. He isn't a physician. He isn't any kind of provider. That's the first crack against him. The second crack is his claim to fame is he ran the auto bailout for the Obama administration. Well, let me tell you how he ran that auto bailout, because I'm from Michigan where we used to build cars, right? What he did is he created a death panel for the auto industry. What he did is he decided which dealerships would stay open and which would stay closed, which would live, which would die. And you know what he based it on, Glenn? He based it on one criterion: how much money they had given to the Obama administration in the 2008 campaign. And those that gave money lived and those that didn't die. So when we talk about the complete lives, you know, we're basing that on Ezekiel Manuel's research about age of the patient. Really? You think they might do some other way to decide if you're going to get a kidney or if I'm going to get a kidney?
No, Doc, that's too far. Yes, I think exactly right.
Exactly.
Kidney donors. Tell me about what they're doing. They're planning on implementing this next June.
What they're saying is that the 20% of the kidneys that are from the youngest donors will go to the youngest recipients. So it doesn't matter any longer how long you've been on that donor list. That's usually how they go: geographic area and then prioritization based on how long you've been on that list. No. It'll solely be based on the age of the recipient.
So in other words, if you are going to be somebody who can use it longer.
Correct.
And so a lot of people will say, well, that's not so bad because there's such a short list of actual donors. Help me out, because my feeling on this is the same thing that's happening now with money. Everybody says it's wrong because you have money and I don't, or whatever, and so I can't get the care because I don't have the money or I don't have the insurance. Well, this is actually putting a group of people in charge. It's no longer the invisible hand of the market. Now it's a physical hand who has possibly an agenda. A
group of people that is directed by bureaucrats, and many of whom don't have any functional medical knowledge or any clinical experience, and they're basing it on one criterion. You know, Glenn, medical school is 4 years. My residency was 5 years on top of that. I did a year's worth of fellowship. Why is it so long? It's because medicine is an art, and it's a science combined. And if you just base everything on one criteria and you cookbook it, people are going to die.
Well, everybody. That's what everybody has a problem with the insurance companies. They only look at the cost.
Right. So when I have to deal with an insurance company, I fight them tooth and nail for my patient's well-being. I've never gotten a rejection after I fought them, and the reason is because I have somebody I can call and there's somebody I can lay it on the line with. When the government takes over the whole process through Obamacare, if I complain, I don't even know who I would call. But if I complain, according to wording in the stimulus bill and the health care bill, I could be penalized for not going along with the government protocol.
Perfect. Real quick, one last fact. The Federal Coordinating Council for Comparative Effectiveness Research, that was in the stimulus package. People will argue and say, well, that didn't make it into the health care bill. Want to explain real quick?
What happened is that council was through the health care bill, the second part was molded into an entire multi-billion-dollar center whose name has been changed 3 or 4 times to get the words comparative effectiveness out of it.
Pretty good, huh? Aren't you excited? Doc, thank you very much. I appreciate it. You keep us alert on everything that is coming our way and happening. Romney have a chance to change this? Can he change it?
I hope so. I question it a little bit because I know what was in Romneycare and what Romneycare was about. I hope he sees the light, and I hope he has the courage to take this on and immediately stop it in its tracks.
So do I. Thank you very much.
Thank you.
Back in a minute.